wonder what actual real life lungs look like? Join me in this video as we talk about the OSPE of our lungs with my students. Okay, so the first thing I want you all to do is identify which lung is of which side. You're going to focus on exactly the cardiac notch and the lingula. I can see it right over here. So be careful of this, that it's not very prominent as it is in the models, the lingula, all right? Normally in the models, you can see the lingula and the cardiac notch very clearly, but in this you can't. But this lingula is something you need to go for. First thing to identify which side it is. So whenever you enter your OSPE, the first thing I want you all to do is make sure you are looking at which side lung it is. So if the lung is kept this way, first do this. Look for the lingula, you see the lingula, it's the left lung, so all the impressions will go perfectly fine. Now let's look at this. This is the right lung, there is no lingula. So this important difference I want you to remember for doing it on the specimen, doing OSPE on the specimens. All right, so here's the lingula, so this is left lung. Let's talk about the left lung. Probably they'll put the pins on the impressions. All right, and the impressions, the first impression they're going to put the pin on is a very important impression is anterior to the root of the lung. This is the cardiac impression. What do you see here? This is the cardiac impression. Another very prominent impression posterior to the root is descending thoracic aorta. How do I know this is anterior to the root, this is posterior? I just looked at the lingula. Lingula is supposed to be in the anterior side, so obviously this is the anterior side. All right, so this is the cardiac impression, left ventricular impression. This is the descending thoracic aorta impression. What else do we have here? We can see the arch of aorta very clearly. And what else? This is obviously going to be the ascending aorta. The pulmonary trunk may lie over here. These are the impressions of the left lung. Let's talk about the root. If they put a pin on this elongated structure below.
So what is the structure? It is the pulmonary ligament. And what is the purpose of this? It's basically to expand, all the root structures of the lung so that they expand within the pulmonary ligament. Now let's talk about the root on that note. This is the root of the lung, and it contains very important structure, and we've talked about the arrangement from anterior to posterior, and the posterior most will be the bronchus. So first I want you to identify the bronchus, the principal bronchus. In the left side we have only one bronchus, and then you go ahead and try to identify the veins and arteries. So that posterior most structure over here you can see is bronchus, and then this right here is the pulmonary artery, because we've talked about it's going to be the superior most content of the root. And then going below we have the superior inferior pulmonary veins. So you can see the bronchus, posterior most content, and then you can even visualize this pulmonary artery, and below it you go for the two pulmonary veins. So let's go ahead and organize this, because I'm sure it's getting very confusing. What is not confusing in anatomy? So basically structures of the root of lung are going to be arranged from anterior to posterior into VAB, and from superior to inferior into ABV. So here we have the bronchus posteriorly, then we have the pulmonary artery, and then we have the superior inferior pulmonary vein. So everything has another side to it. Let's go and flip the lung and look at the other side, which is the costal surface. First thing you see is the oblique fissure. Here is where they will place the pins on the OSPE. And then we have the upper lobe and the lower lobe. So don't worry about the bronchopulmonary segment. They'll probably never put a pin on the bronchopulmonary segment in cadaveric lung. Otherwise they would if it was a model. All right, let's talk about the right lung now. We all know there are going to be three lobes. Firstly, this is the anterior border. It's straight. It does not have any significant features like the lingula or the notch. Here we have the very important long fissure that goes inferiorly. This is going to be the oblique fissure, and the one going horizontally is going to be the transverse horizontal fissure. Divides into an upper, middle and lower lobe. And then we have the apex of the lung. Let's talk about the medial surface here as well. First, let's talk about the root of the lung. Now, the root is going to contain about two bronchi, which is in contrast to the left lung. So here it gets a little confusing, and I'm going to figure it out. And yes, here we go. So posterior most content is supposed to be the bronchus. So you can see in one hole, there are going to be about two openings. So upper one is eparterial bronchus, whereas the lower opening is going to be in the same circular lumen, is going to be the hype arterial bronchus. I hope you understand. So superiorly is the ep, and then inferiorly is the hype. So this is hype, and this entire lumen is going to contain both these important bronchi. And sadly, I have no clue what I was telling my class at this time. My microphone died. I am crying right now that I have to voice over this entire OSPE. Thank God I finally move on to the pulmonary artery and then the two pulmonary veins. So once again, what are the contents? This eparterial, hyparterial bronchus, anteriorly the pulmonary artery, then two pulmonary veins. So let me just get the order right one more time. So there's the order of arrangement of structure of the root of the lung. And here, once again, we have another pin that will be placed to the pulmonary ligament, elongated version of the root below the root. Yeah, that. Anyway, let's talk about the impressions. Anterior to the root of the lung are going to be the rasp, superior will be the ATV, and posterior will be the O. What is the rasp ATO? So first we have the rasp. RA is for the right atrium, right over here, and then we have the S for the superior vena cava. The P is for phrenic nerve, but most likely they will never ask you about the phrenic nerve in a cadaver. Rather, they'll ask it in the model. Okay, so what am I saying next? I cannot remember. Okay, yes, the superior. This is the arch of azygous vein right here. ATV, we're coming to the superior of the root. This over here is going to be for the impression of trachea. And the vagus nerve, once again, in the models, you can see not over here. This is the impression posterior to the root, O. This is the esophagus. So there you have it. That's the medial surface of the lung. And these are the two lungs. So the most important part is that this is the descending thoracic aorta impression is not going to be present in the right lung. So there is another distinguishing feature between the right and the left lung. So this very prominent impression is only going to be found in the left lung. So I hope you can remember that also to differentiate between right and left lung. No idea what I was saying here. So let's just let that go. Now we have the heart. Let's talk about the heart specimen. What we can see in the heart is the various chambers. So here I was probably distracted by a student. Can we go back to the heart? Oh, yeah, thank God. Okay, let's talk about the heart now. So basically the chambers once again. So I can see we are going to start with the right atrium. This ear-like projection from the right atrium you see anteriorly is known as the right auricle. It's like an ear-like projection and it's going to be anteriorly. Okay, then we have the right ventricle. We have the left ventricle. And finally, posteriorly, this mess you can see, yeah, this mess of a thing, probably you're going to label it as the left atrium, especially if it's lying posteriorly. So what am I going to say here? Okay, we're going to talk about the great vessels, and now I'm about to leave this heart because I'll realize that the great vessels are missing in this heart. Okay, so switch, or let me just like make the switch happen quicker than it needs to. Yeah, that's more like it. Two hearts are better than one. So over here we can visualize the great vessels much better than we could in the previous heart. What can you see here? The most important vessel of the heart is going to be the aorta. So this is the ascending. This is the arch of aorta. You can see the three branches coming out. The rightmost is right brachiocephalic artery. We have this going towards the head and neck and the upper limb. The one going to the head and neck is the left common carotid, and finally the left subclavian artery. Here, left auricle is also visualized, going to be lying anteriorly, whereas the left atrium is going to be lying posteriorly, and probably pulmonary veins are going to be lying in that mess posteriorly once again. No idea why I'm poking the heart at this point. Probably trying to tell you what the pulmonary veins are looking like. I guess that's all for the external features that I can visualize in the specimen. I guess these are the pulmonary veins. Now let's open up the heart and look at that broken heart going crazy. You can see the ridges, important ridges. These are basically the ventricles. You can visualize that these ridges that are very prominent, probably that's where the pin is going to be placed in your Ospe. And this pin will be placed in these are known as the papillary muscles. So whenever the pin is placed here, it's probably the papillary muscles. You can see even the chorda tendon is arising from these muscles. They are like thread-like structures arising from the valve. This is basically the structure of the valve. And then you'll see them progressing into the cusps. So these are the cusps. Then we have the papillary muscles. And chorda tendon, probably they wouldn't want to put a pin in that because they'll break. And I assure you, they wouldn't want to break a heart that is already this damaged. So here's the interventricular septum between the two ventricles, and you can see the walls of the two ventricles. The left ventricle wall is thicker than the right ventricle, obviously because it has to pump blood to the entire body. And this is where I call it a day, and we are done with the specimen Ospe. Thank God I do not have to do another voiceover again. Really hope my mic works in the next video. And here I forgot to film the outro, so yeah, I'll just place this clip right here in slow-mo. Thank you so much for watching.